The sphenoid bone is one of the most complex and centrally positioned bones of the human skull, often described as the keystone of the cranial floor due to its strategic location and extensive articulations. Situated at the base of the skull, it contributes to the formation of the cranial cavity, the orbits, and the nasal cavity, serving as a structural and functional crossroads where multiple anatomical systems converge. Its central position makes it a point of integration between the neurocranium and the viscerocranium, linking structures related to the brain, vision, mastication, respiration, and endocrine regulation. From a morphological perspective, the sphenoid bone exhibits a highly distinctive butterfly-like shape composed of a central body and three paired processes, the greater wings, the lesser wings, and the pterygoid processes. This morphology is not random but reflects biomechanical efficiency, developmental complexity, and evolutionary adaptation. The lateral vistara of the wings increases the surface area for articulation and force distribution, while the central body acts as a core support structure for critical neurovascular elements. The body of the sphenoid contains the sphenoidal sinuses, which are pneumatized cavities that vary significantly in size and shape among individuals. These sinuses reduce the overall weight of the skull, contribute to voice resonance, and may play a role in insulating sensitive neural structures. Clinically, their proximity to the pituitary gland, optic nerves, and cavernous sinuses makes them highly relevant in pathology and surgical approaches. Superiorly, the sphenoid body presents the sella turcica, a saddle-shaped depression that houses the pituitary gland. This region is subdivided into the tuberculum cephali anteriorly, the hypophyseal fossa centrally, and the dorsum cephali posteriorly. The anterior and posterior clinoid processes serve as attachment points for the tentorium cerebelli, a dural fold that separates the cerebrum from the cerebellum. This structural arrangement demonstrates the integration between bone and meningeal architecture. Laterally to the body lie the cavernous sinuses, venous plexuses that contain the internal carotid artery and multiple cranial nerves, including the oculomotor nerve, trochlear nerve, abducens nerve, and the ophthalmic and maxillary divisions of the trigeminal nerve. This close anatomical relationship explains the severe neurological consequences that can arise from lesions, thrombosis, or infections in this region. The lesser wings extend laterally and form part of the anterior cranial fossa, separating it from the middle cranial fossa. They contribute to the formation of the optic canal, which transmits the optic nerve and the ophthalmic artery. The superior orbital fissure, located between the greater and lesser wings, allows passage of cranial nerves responsible for eye movement and sensation, as well as venous drainage through the superior ophthalmic vein. The greater wings are large lateral expansions that contribute to the middle cranial fossa, the lateral skull wall, and the posterior orbit. They contain several important foramina, the foramen rotundum, transmitting the maxillary nerve, the foramen ovale, transmitting the mandibular nerve, and the foramen spinosum, transmitting the middle meningeal artery and vein. These openings establish critical communication pathways between intracranial and extracranial regions. The pterygoid processes descend inferiorly and consist of medial and lateral plates that serve as attachment points for the muscles of mastication. The lateral pterygoid muscle facilitates mandibular protrusion and lateral movement, while the medial pterygoid assists in elevation of the mandible. The pterygoid hamulus acts as a pulley for the tensor veli palatini muscle, linking cranial structure with swallowing and auditory tube function. In terms of articulations, the sphenoid bone connects with the frontal, parietal, temporal, occipital, ethmoid, zygomatic, palatine, and vomer bones. This extensive articulation network reinforces its role as a central stabilizing structure within the skull, distributing mechanical forces and maintaining cranial integrity. Embryologically, the sphenoid develops from multiple ossification centers through both endochondral and intramembranous processes. Its growth is closely coordinated with brain expansion and facial development, and abnormalities in this process can result in craniofacial syndromes and structural deformities. From a clinical perspective, the sphenoid is associated with numerous conditions. Sphenoid sinusitis can affect adjacent neural and vascular structures, potentially leading to visual disturbances or cavernous sinus complications. Pituitary adenomas may expand within the sella turcica, compressing the optic chiasm and altering hormonal balance. Fractures involving the sphenoid can disrupt cranial nerves and cause cerebrospinal fluid leakage. Surgically, the sphenoid provides access to deep cranial structures through the transsphenoidal approach, which allows minimally invasive removal of pituitary tumors via the nasal cavity and sphenoidal sinus. This technique highlights the anatomical accessibility and clinical importance of this bone. Biomechanically, the sphenoid acts as a central hub for force distribution across the skull. Its shape allows it to absorb and redirect mechanical stress, protecting vital structures while maintaining structural cohesion. The integration of rigid and pneumatic elements enhances both strength and adaptability. From an interdisciplinary perspective, the sphenoid bone can be studied through anatomy, physiology, neurology, endocrinology, radiology, and biomechanics. Imaging techniques such as computed tomography and magnetic resonance imaging are essential for visualizing its complex structure and diagnosing associated pathologies. In a broader conceptual sense, the sphenoid bone exemplifies the interconnected nature of human anatomy, where structure and function are inseparably linked. Its form reflects not only mechanical demands but also developmental processes and functional integration across multiple biological systems. In conclusion, the sphenoid bone is not merely a structural element but a central integrative component of the skull, playing critical roles in protection, articulation, neural transmission, vascular connectivity, and endocrine function. Its comprehensive study requires a holistic and interdisciplinary approach, revealing the depth and complexity inherent in human anatomical organization.